You need them to be your healthcare Sherpa. Let me tell you the questions that you need to ask. These are the ones I would ask as an insider to the industry. One, I'm gonna ask, what's the size of the patient panel? There's a difference between traditional fee-for-service practices that most of us, the doctors we've seen, they're typically going to have anywhere between 3,000 and 5,000 patient records. That's not necessarily how many they're going to see in a year, but that's how many records they're going to have or patients they've got on their panel. You're typically, for a DPC practice, you're looking for less than 500 per doctor, but you certainly want to have less than 1,000. Ideally, it's going to be 500, 800 or less. Second one is going to be, what's their philosophy of care? There is a difference between treating acute symptoms and just throwing a pill at everything. And a lot of the DPC providers are getting out of traditional fee-for-service medicine. They're getting into DPC because they want to get back to root cause medicine. They went to college, they went to medical school to study the practice of medicine, not dictating what the manual says and what insurance will pay for. They want to treat patients. They want to treat the root cause. So you're looking for a doctor or in a practice that says, we're going to look at you as whole person root cause medicine. Third piece of this is going to be, what's their coordination or care navigation abilities? If I don't know how your employer plan is set up, probably not going to have a care navigation program or incentive program for you to get lower cost care. But it does matter to you, particularly if you're on an HSA and you have a high deductible plan, having a doctor, particularly your primary care, that has relationships, and they generally do, in the community with the local hospital facility. They know who the right specialists are. They're going to know who the good doctors are and who the not so good doctors are, and they're going to steer you to the ones that are high value. That means they're providing the best quality care at the lowest possible price. That's the intersection where you find the best value. The last thing I would ask the DPC practice is, what are my options for accessing care? Is it in-person only? Ideally, you're looking for the combination of in-person and virtual. A lot of care can be conducted virtually. You'd be surprised how much can be done virtually. Those are my tips and tricks to find a DPC practice, to vet them out. Use those questions. It's going to really help you ferret out